If you were running DOGE right now, what would the advice be? Where should they start? What should they avoid? Where is the low-hanging fruit in the VA,
Well,
if
I'm
there
not
isn't?
sure that DOGE is taking the right approach here. Where I always start with any effort is what's the outcome I'm trying to achieve? If the outcome is a pure cost reduction or headcount reduction, then I think they're going to have a very hard time doing what they're doing. I would suggest that's the wrong outcome. If the outcome is to make the agency more efficient and produce better outcomes with less money, that's a objective that I think people can understand. And I think where they've gone wrong on this is that they haven't articulated what the end game is. Instead, they've just focused on reductions. If you take my point of view, which is this is about serving veterans, this is about doing a better, more efficient job in delivering those services, you have to begin to start thinking about how do you modernize the systems at VA.
Welcome to Analyzing Healthcare by Scale Community, which is an education-focused organization comprising of passionate global healthcare leaders. Analyzing Healthcare is Scale's podcast series dedicated exclusively to unpacking the myths and foibles that have been directed at US and global healthcare for as long as we can all remember. Is US healthcare broken? The worst in the world? Perhaps, perhaps not. Let's find out together as we invite thought leaders of healthcare to share their views. I'm your host, Roy Bejarano.
Okay. I'm joined by Dr. David Shulkin, the former Secretary of the U.S. Department of Veteran Affairs. In other words, former head of the VA and cabinet member under President Trump and President Obama. And I think it's a very timely conversation to have with David about what's going on in the VA right now, given all the news that we're seeing from DOGE and most recently a Wall Street Journal article that focused on some of the issues that might be manifesting there or not. So I thought, why not speak to someone who probably has the deepest understanding for the VA in the country. So David, welcome.
Thanks. Glad to be with you, Roy.
My pleasure. So what is going on at the VA right now? What's your best sense of what DOGE is looking to do, what it's successfully doing, what it's unsuccessfully doing? What would be your takeaways?
There's a lot of confusion, Roy, and that's because it depends on who you ask what they're trying to do. There are clearly many objectives in Washington. This is part of the environment. I think you have to look at 3 or 4 different groups that care deeply about what happens at VA. There is the effort going on at DOGE. There is the political effort from the White House. There is the agency itself, there's Congress, and then there's the veteran community themselves. And each of them has a slightly different understanding about what the current situation is, and each of them have different objectives that they're trying to achieve. I think when you look at DOGE, which was really your question, Roy, they're looking to decrease the size of government. And the VA is a ripe target because it's the second largest government agency. It employs almost 450,000 people, and it's grown considerably in the last couple of years. So I think that they've taken a very significant interest in what's happening at VA and have made recommendations. And now you're seeing reactions from the other groups I've talked about.
So just to put it in context, 50,000 employees would make it one of the largest employers in the country. I think Disney is about
as I'm concerned,
250,000.
only the Department of Defense is bigger with a couple million employees.
Yeah. And so where do you think they should focus? If you were running DOGE right now, I know you're in conversations with them. So thankfully, it does sound like they're looking for some insight and some experience. But what would the advice be? Where should they start? What should they avoid? Where is the low-hanging fruit in the VA?
Well, I'm not sure that DOGE is taking the right approach here. Where I always start with any effort is what's the outcome I'm trying to achieve? If the outcome is a pure cost reduction or headcount reduction, then I think they're going to have a very hard time doing what they're doing. I would suggest that's the wrong outcome. If the outcome is to make the agency more efficient and produce better outcomes with less money, that's an outcome, that's a objective that I think people can understand. And I think where they've gone wrong on this is that they haven't articulated what the end game is, what their objective is. Instead, they've just focused on reductions. And so clearly, if you take my point of view, which is this is about serving veterans, this is about doing a better, more efficient job in delivering those services, you have to begin to start thinking about how do you modernize the systems at VA? How do you use technology to make the workforce more efficient and ultimately to reduce costs with faster turnaround times and better outcomes? And if we focus on the modernization efforts and achieving the objectives, then I think that's something that everyone can get behind.
I think that's very well said. Most likely, I don't know because I've never worked in the VA, I would guess that their tech stack, the systems that they use to capture data on their patients, their patient experience, the actual treatment plans that their patients go through, I would imagine those systems are antiquated. And I imagine that the concept of coordinated care, value-based care, risk-based, performance-orientated, bonus-driven, capitated rates, carefully selected provider groups that can perform with ever more demanding milestones in place. All that sounds like it probably isn't deeply embedded within the VA today. If I had to guess, I would say the VA functions on a fee-for-service model with its payer providing mostly fee-for-service incentives for treatment. Is that fair?
Yeah, and it's not necessarily the VA's fault. The payment system that VA has been using, particularly to pay its providers outside of the VA system, was legislated by Congress. It gave the VA the authority to pay fee for service on a Medicare fee schedule. In more recent years, they've been given a little bit more leeway to adopt some more pilot or innovative approaches towards value-based payment. And I know that they're looking hard at that, but still the primary way that they've been authorized to pay has been fee for service. In a similar way, the information systems, the technology stack that you refer to, all of those authorizations need to come from Congress. And so the VA needs to make a strong case. It needs to compete in a very tight federal budget to get those dollars. But when they get them, they also have a complex situation in implementing new technology across such a massive system. So while the VA was an initial innovator with electronic health records back in the 80s and 90s and was really way ahead of where everyone else was, that old technology grew old. It was MUMPS based. It was hard to maintain, hard to modernize with the new tools of AI. A decision I made in 2017 was to move the VA away from that older system to a more commercial system. But the VA, even though it got the dollars, has been very slow in implementing that. And to date, only has 6 out of 170 of its medical centers converted onto that new system.
6 out of 170, which tells me that 164 out of 170 are still old, antiquated system.
Yes, that's correct.
Okay, and to delineate between the VA and TRICARE, do you see much difference in TRICARE's approach to incentivizing treatment? I would guess that TRICARE, which is for active duty individuals or members, there's also a heavy focus on fee-for-service and very light touch on coordinating care, focusing on things like hospital admission rates, readmission rates, and population health in general. Is that fair?
Yeah, it's hard for people to understand that sometimes VA and TRICARE are different systems. TRICARE is operated out of the Defense Health Agency, out of the Department of Defense, and VA is operated out of the Department of Veteran Affairs. But in reality, these two systems have many similarities, and there's a significant duplication of effort and duplication of infrastructure by running these systems separately. And so one of the issues that I think really does need to be taken a look at is how can they share networks? How can they share resources? How can they learn from one another and do a better job for the populations that they serve, which essentially are very similar populations. Now, the TRICARE network, of course, includes families. And so there's a pediatric and a larger women's population than the Veterans Affairs Department has. But overall, they share the same objectives for trying to keep people healthy and well.
And just so everyone understands the scale of this, TRICARE covers 9.6 million people. And the VA today covers how many beneficiaries in your mind?
About the same amount.
About the same. So it's about 20 million people, give or take, combined, whose health is paid for just between those two programs alone. So, shy of 10% of the entire US population, but not that far off, between 5 and 10%. So huge number. And to say that most of that, 90+% of that, is pure fee for service tells you that there's a wonderful opportunity to create value here through data analytics and coordination. But I don't know if DOGE and Elon Musk want to hear that, because guess what? That's going to take some time.
Yeah, and part of this is that in order to achieve the types of savings that they're looking at, they are looking at doing things quickly, and that's why they're looking at canceling contracts that can be canceled, because most contracts have a convenience measure when you do business with the government, that a contract can be canceled. It's not pleasant, but it's relatively quick to be able to eliminate positions as well. But when you're talking about changing policy, or you're talking about changing or implementing new systems or changing the way of doing business, that actually takes longer. And so I think that's probably not one of the initial objectives of the DOGE effort.
And the VA is very self-reliant. I imagine a large percentage of those 400,000+ FTEs are clinicians delivering care. I'm not sure the TRICARE and the Department of Defense is the same setup, although clearly the DoD employs a lot of servicemen and women who are providing healthcare.
What?
How do you compare those two?
Yeah, the Department of Veteran Affairs is largely, think of it as a large integrated delivery system, because it has the responsibility of delivering care to veterans no matter where they live. And so many veterans live in rural areas where healthcare is hard to access. So the VA does have more than 1,200 facilities around the country. The Department of Defense, you have to think of very differently. They're really two objectives. The first objective of the Defense Health Agency is to have the men and women in the military prepared for deployment. And that means that they have to be ready and capable of being deployed when the order is given. So most of the military personnel that are healthcare professionals are focused on that mission. They are maintaining and supporting the active duty soldiers and other troops. The TRICARE part of the Defense Health Agency is focused more on the dependents. So they can surround themselves with their locations around military bases where most of the families live, but they largely are a network. Think about them as a health plan. They essentially use Humana and now TriWest, the two companies, to develop a network of providers that are out in the communities that are willing to see the TRICARE members just like they would any other health plan. And that's a different system than generally what the VA has, although the VA does have its own community care network separate from TRICARE, where it does pay providers to take care of veterans as well.
It is interesting to compare the two. So if the VA is 400, give or take, 450,000 FTEs, the Department of Defense employs, give or take, 150,000 healthcare employees. VA 3 times more staffed up than the DoD. If the VA has 1,100 outpatient locations, the Department of Defense has 450 hospitals and clinics. So it's not like for like, but similar, and 50 hospitals on top of that. The VA has 170 what it calls medical center full service hospitals. So again, the ratio is about 3 times greater in both cases. Interesting that they both take care of a similar number of people, but the VA seems 3 times more built up. And I do think of the VA as a payer system. It might be worth noting that the DoD's average age of an average patient is probably a third of the average age of an average VA patient. Would that sound directionally right to you?
Yes, that sounds
Very
right.
different demographic. Okay. And so I would probably guess, and I'm doing this real time, that utilization is 3 times greater or more in the VA versus the DoD. There's a lot of need as you get into retirees, as you get into those who have served, the vets, and versus utilization of a young 20-something-year-old who's not necessarily deployed. Okay, so you were behind the Mission Act for the VA, or at least a key figure in it. What was the Mission Act and what came of it?
Well, the Mission Act really was a follow on to a program that was put in place during the Obama administration in response to a national wait time crisis for veterans, where veterans were having a hard time just getting seen and getting appointments. And so, as a result of what became very clear, this crisis, the President Obama, and Congress moved forward with a plan called Choice. What the Choice Act did was it allowed veterans who were waiting for care to be able to go into the community to find the community doctor or hospital, and the VA would pay for that. That was authorized initially as a 3-year program. At the end of 3 years, the program was due to sunset. I was secretary, and I discussed with the president that I think that this program was largely successful and it was necessary, that if we went back and we just eliminated the choice program, that we'd be back in the situation where veterans would be waiting for care, and that would be harmful to them, of course. So we asked Congress for permanent inclusion of the community care network, and that is what is called the Mission Act, and that passed Congress and signed off by the president in 2018.
So what was the result? What has changed in the VA
The
on the
result
back of the
is,
Mission Act?
yeah, the result is that now it's a permanent part of the law that veterans have the right to be able to go out and get care in the community, as well as the option or the right to get care in a VA medical center. And so this is now a system that is very much a hybrid system of care where you can get care either in the VA or care outside the VA. Approximately 44% of veterans are now getting care outside the VA in the community care network.
Okay. And if we had a pie of 100% that represented the total spend on care by the VA, how much of what percentage of that pie would represent the private sector, providers outside of the 450,000 employed, locations outside of the 1,200 outpatient clinics, 150 VA? What percentage represents the private network?
About a third is the private network.
Third.
Yeah.
Okay. All right. And so significant change there on the back of the Mission Act.
Yes. Yes. Yeah. The VA has
Yeah.
changed in the last 8 years quite significantly. Yes.
And net, do you think that also drives more efficiency in the 2/3 that is represented by the VA, taking direct ownership of delivery of care? I mean, you think about the VA, it's almost the closest thing we have to the NHS. It's government funded and government delivered care. So it is interesting to see what happens to it over time as it experiments with different delivery strategies. So it has the 1/3 private sector, which, by the way, the NHS is also doing, right? The NHS is outsourced in England a growing percentage of the delivery of care to the private sector. I'm wondering, to what extent have you seen that private sector influence the way that the 2/3 VA component functions? New systems, new investments, new methodologies and reimbursements, new treatment plans. Is there crossover in knowledge sharing, or they're sort of independent of each other?
Well, first of all, the presence of both the VA internal system and the community care system became a necessity because the system was breaking under its own weight. The demand from veterans
Let me guess,
returning
too much demand, too little supply.
exactly. And so
What a surprise.
this was a quick response that actually worked pretty well, giving the outlet for veterans to go out and get care in the community. But at this point, what I would say is rather than these two systems working synergistically together and working to make each other better and more efficient, they actually are competitive with one another. And therefore, it is actually a very inefficient system of care, maintaining both a full internal VA system and a full community care system. And what really needs to happen at this point is there needs to be an overall rationalization of the way that the system works. Now, I have argued, and I argued at the time, and I continue to believe this and have written a book about it called It Shouldn't Be This Hard to Serve Your Country, that the way that one rationalizes a healthcare system is by using clinical criteria, and that you start with what is best for the veteran and where can they best achieve the optimal outcome, either in the VA system or outside the VA system, or a combination of both, but it should be defined along clinical metrics. What we have today is a system that is defined on administrative metrics, days of waiting or miles that a veteran is located from a VA. And by definition, to me, that makes the system unfair and competitive for some veterans. If you happen to live a mile from a VA, or you are another veteran who lives 50 miles from a VA, you now have access to two different types of clinical standards of care, and it shouldn't be that way. So I believe that this system needs a strong rationalization, and to make these systems synergistic with one another around the needs of the individual veteran. And without that, I think we're going to see a lot of significant barriers to care. We're going to see limitations on access to care that are not in the veteran's best interest, and we're going to continue to have a economically inefficient system.
I was going to guess that without a lot of supervision, care, and attention, the gravitational pull towards having a private sector solution and a public sector solution for VA patients, the gravitational pull would be towards conflict and distrust and competition that is actually unhealthy versus collaboration and resource sharing. Because if I am not cooperating with you, I'm seeing you as a threat to my employment.
I think that's absolutely right, and that's really the dynamic that you have right now. People in the VA system who work there believing that their jobs are threatened by the community care network, and every time a veteran goes outside the VA into the community care network, they look at it as that's less reason I need to be there. And the community care network is resentful of the barriers to care and the fact that they have to go through extensive authorizations. And so it's a system that just is screaming for essentially a streamlined patient flow design that works for the veteran, not for the bureaucrats.
And this is really the limitations of DOGE. Although I don't get really the right to critique Mr. Musk, because he's built a lot more in one lifetime that I think I will build in 100 lifetimes. But it does appear to me that there's only so much that you can build through pure conflict and acrimony and tension. Call it the hedge fund culture to creating value. Well, hedge funds don't build factories or bridges or anything for that matter. Now, what's interesting is that Elon's chainsaw comes with, amazing success across different industries where they've engineered and built wonderful things. But I don't know how that reconciles with a culture of pure metaphoric violence where everyone's job is constantly in peril and thousands of people's jobs get discontinued at the flick of a switch. Now, maybe he has two modes. Maybe he has crisis turnaround mode. I just bought Twitter. What am I supposed to do now? And maybe he has stable mode. My business is strong. It's worth hundreds of billions of dollars. And I can be very nice and supportive. I don't know, but it seems like there's a limit on how far you can push everyone distrusting everyone and still create value.
Well, we're in such a politically polarized environment that it's easy to point fingers and make everybody look at a bad guy, look like they're doing bad things, no matter what side you're on. But the reality is that I believe that in general, people's intentions aren't necessarily bad here when it comes to what they're trying to do. They may have different principles, they may have different belief systems, but I predicted that this model of Elon Musk being outside the government was never going to work, and it was going to create this type of chaos. And again, that's not to say that I'm not sympathetic with the objectives here. I do believe government has gotten too big. I do believe it is healthy to take a look at what government is doing and make refinements and change direction. I think that was part of the mandate of this last election. And I have never said, even when I was secretary, that the issues in the VA were because we didn't have enough money. If anything, I thought Congress would always give us more money than we actually needed. So I'm very aligned with what he's trying to do. But the reason I thought this was a terrible idea and I still think it's a terrible idea to be doing this, is that I can very much relate to the problems that are occurring. I was a private sector CEO. I was running a hospital in northern New Jersey when President Obama asked me to leave that job and to come to government, to the VA. And I had been running hospitals for a while. I thought, hey, I know everything about running hospitals. How different could the VA be? And when I got there, I recognized that my instincts and my experience didn't really help me in the VA. It is a very, very different system with a set of rules largely defined by Congress and lots of oversight agencies looking at the way things are done and buying things differently, and employees with different sets of expectations and rules, that I really needed to just spend my time until I learned enough about the system that I could be helpful in changing the system. If I had tried to do that by never becoming a government employee and having accountability that way, I know I couldn't have done that. And so I think that you either decide, if you're in a situation like Elon Musk, that you walk away from what you're doing in the private sector and you become a government employee like a cabinet agency, a cabinet official does, and you're now accountable and running that. But to sit on the outside and think that you know how to do this and just sort of give advice that you expect people to listen to, I think is a very challenging way to do this. And I don't expect people to understand that. I can just tell you I've lived this. So I think that I saw some of these problems right from the beginning.
Yeah, look, we oversimplify, all of us, myself included. We're all guilty of that sin. Just because we wasted money in 100 different ways, 1,000 different ways, strange cultural projects in some remote land that no one's ever heard of. I don't know. Pick an example. It doesn't mean that taking care of 20 million people and employing 600,000 in order to do that, and those people are either serving our country or have served our country, fits into the same category, right? Not everything should function at the same speed. I would say most things you want to be careful about, but certainly you can't bucket everything with the label government, and therefore it's all a waste of money. And somehow I get the sense that everything is being treated equally. Everything is at equal crisis, and I'm not sure that's the sensible way to go. I know the counter argument. Believe me, I follow the counter arguments very closely. I get it. 36 trillion of debt, $1.2 trillion of interest currently. We are in financial crisis. But even in a crisis, using the private sector as an example, a company turnaround, you have to still be thoughtful. And it's not, you can't throw everything out the window. So definitely
I
a very
think
timely conversation.
Yeah, and I think you're absolutely right. To argue that we should be staying the course and keeping the status quo, I think is the wrong choice. We unfortunately do need to make some of these hard decisions, and they're not going to always be popular for sure. And I do think that the new administration is taking that at heart. But I think the way that they are explaining what they're doing, the way that they're making their choices, is causing additional and unnecessary polarization. Again, I strongly believe the way you start any change initiative is you have to describe the outcome, the vision, where you're headed. The only way that people want to follow you or know how to give you advice or know how to help or know how to criticize the plan is if you tell them where you're headed. And so, if we're going to improve the VA, you have to talk about, well, because what we need to do is we need to do better at reducing veteran suicide. We need to reduce the wait times. We need to make veteran benefits not a backlog of close to 1 million claims, but let's get that backlog down to less than 25,000 claims. The way which we're going to do that is the following. We're going to invest in the technology here. We're going to train the workforce there. We're going to redo workflows. We're going to change the law to make it easier. There's a whole number of objectives, but then people understand why you're working on those solutions and why it may be necessary to make some hard decisions to get to where you want to get to. And I just think that's the piece that we've not been seeing. Everyone's been seeing the people getting laid off or the reduction in services or benefits, the or things that are highly polarizing. News today was that the VA is going to stop transgender care. Well, there were 134,000 transgender people that raised their hands to serve this country and sacrifice for this country. And when we accepted them into the military, we signed on to a commitment to make sure that we're going to be there for them when they got out of the military. And so it's natural that people are going to have strong feelings about this, but to me, the key issue is how do we focus on that central mission of serving those who have served us by being, the less than 1% of this country that does serve in the military.
So you raise another point. Just because you can do something doesn't mean you should. There are commitments that have been made along the way. There's history, and it's important to keep that in mind when you make decisions, because ignoring history typically comes back to bite you in all kinds of ways. So let me ask you on a practical level. You were a cabinet member for years. Cabinet members, having never served as one, are they invited on a monthly basis, quarterly basis? Are there Zoom phone calls? Are they there listening in to all the cabinet leaders provide updates? Are you strictly there focused on the VA? And also on this topic, if you had to simulate, if you were the head of the VA today and Elon was driving his DOGE effort, how would that back and forth play out? Would it be at a cabinet meeting, a dedicated meeting just to this topic? You would show up with your slides, use the power of argument and persuasion, then go off and maybe campaign in front of the press to reinforce your position and get public support. Imagine you were at the cabinet today. What would it look and feel like?
Well, you've asked a bunch of questions, so let me try to quickly just go through the parts that I think are worth spending some time on. I think the issue about the strategy that I would take with Elon Musk today is that I would be out in front of him. I wouldn't be waiting for him to make the actions and then me as cabinet secretary be responding to them, because then it's too late. And it's a no-win game to be doing your criticism of DOGE or the administration in the press. If you're a cabinet secretary, you're there as part of the administration. So what I'd be doing is understanding that what Elon Musk wants, he wants results, he wants them quickly, he wants to see action being taken. And so I would beat him at his own game, and I'd be out there and I'd be announcing exactly what I've described during this podcast is what I'm trying to do, how I'm going to do it, and the hard decisions I'm going to make to get it done. And communicating directly with Elon Musk is great, but actions even better. And each agency does have DOGE representatives, and so whether you're keeping them in the loop and they're keeping Elon in the loop through their channels, or you're communicating directly with Elon, that doesn't matter as much as the fact that you as an agency head have a plan. In terms of what it's like to be a cabinet member in administration, the Trump administration, let's say, the president is mostly a in-person, come and talk to him, come and tell him what you're going to do. And he's got a very similar personality than what I just described with Elon Musk, in that he actually likes action. He likes to know that you're taking the initiative and making recommendations for the president to decide upon. So when I wanted to see the president, I had a Oval Office badge. I'd go and I'd obviously talk to his scheduling secretary, but the president usually had a fairly open door policy, unless, of course, he had other commitments going on, and could usually get in to see the president very soon, as long as he was in town, and get right to the point and tell him what I was recommending. And he usually gave me an answer, yes or no, right away as well. And that's his style. Cabinet meetings generally are scheduled when the president wants to have them. They have a formal agenda. Every cabinet member sits there and waits to go through the agenda. And I don't recall a single cabinet meeting where we even looked at the agenda, because usually the president takes over and talks about what he wants to talk about and is very interactive. He'll ask you, if you're sitting there, what do you think about something? And so the president generally likes to control those meetings and control the agenda and what's being talked about, despite the best plans to have a formal agenda. They're usually not necessarily followed. But that's the way it should be. The cabinet should be a reflection board, a sounding board for the president to be able to give the input that he is looking for. And the president is generally very interactive, asks questions, talks about his opinions. It's not a secret usually where the president wants to come out on topics. So, I think that, whether you like the president's cabinet selections or not, I think a lot of people who have been in these roles believes it's very important that the president have people that he trusts and that he's willing to be open with and willing to listen to. And so hopefully that's the type of cabinet that he has today that will serve him well.
And so the topic of the VA and the issues in the VA and the concerns is normally behind closed doors, one-on-one with you and the president, or every time there is a cabinet meeting, that there's in the agenda a section for the VA, but you don't know whether you'll ever get to it because Marco Rubio goes first, Secretary of State, and before you know it, 2 hours have been eaten up just talking about foreign affairs.
Yeah.
Is that a close description?
Yes. The cabinet meetings generally are not the place where one would do their business. They are done individually with individual meetings with the president, or often, if they involve more than one agency, the president and, of course, the chief of staff of the White House will call together several cabinet members who sit in on a meeting with the president, or alternatively, use the White House as a place to call together cabinet members to discuss issues, even if the president's not there, but with other members of the West Wing staff to talk about things particularly. And that's what a good chief of staff does, by the way. They organize those types of meetings and make sure that when people do go talk to the president, that they're prepared, they have the questions answered and the information necessary so the president can make a decision. So, but, the president enjoys when several cabinet members give different perspectives on things. And so it would be very common that if there was an issue that involved the VA, the Department of Defense, the Secretary of Energy, which had a number of corollary programs that VA did, that we would all get together and talk about those things.
I was going to speak about these other departments and which of them did you work most closely with, if any? And so the VA finds its way into many tangential or adjacent categories like homelessness, housing, employment and training, medical research, which when I think of medical research, I think of the NIH, I think of the CDC. I don't necessarily think of the VA. Disability compensation and benefits, again, labor, the GI Bill, which is education related. So now I think of the Department of Education. I think of the behavioral health aspects of suicide prevention, which is another department under CMS. So are you often walking into these presidential meetings arm in arm with other departments that you've collaborated with, or are you typically speaking as the singular voice?
Yeah, many of the things you talked about actually all exist within VA. So disability is all within VA. The GI Bill is within VA. The suicide prevention efforts and behavioral health is all within VA. So I would say 80% of the time when I was dealing with the White House, it was me alone with the president on VA issues. But you are correct. There are many times that the White House serves as a convening point to bring together those various touch points. And, the touch point that was clearly the most important to VA was the Department of Defense, because I knew where every one of our future customers was going to come from, and that's the Department of Defense. But you are correct. Our homelessness initiatives within VA, we coordinated very closely with the Department of Housing and Urban Development. Our research efforts, our cancer research efforts, we coordinated with Health and Human Services, as well as, you're right, SAMHSA, which is the suicide prevention, which is part of HSS as well. We worked with labor, we worked with energy because of their computer systems. They had the massive computer systems in the government, and that was important to VA for a number of our research enterprises, and many of the others, even transportation and homeland security. Largely, that's the reason why VA is its own cabinet agency. Largely, this is all controlled within the VA.
Okay. David, I really appreciate your time today. I learned a lot. I think it's an incredibly timely conversation. And I'd love nothing more than for maybe DOGE or some representative of DOGE to listen to your words here, because they're words of great wisdom, born of tremendous experience and passion for the space. And so I'm hoping that we get the message out.
Yeah, I appreciate it. And I would just say, look, it's a really important time for the country. It's important that, to me, that veterans issues don't become political issues or become more polarized than they are. I was confirmed by the Senate 100-0. That was a time when, Republicans and Democrats saw a lot of differences, but when it came to supporting our veterans, came together. And I think that's so important, because when our men and women who volunteer, if they start thinking, well, I'm a Democrat or I'm a Republican and I'm not going to volunteer for this, for the military, I think we're all in big trouble. So I think that this is really important, that we make sure that this goes right over the next couple of years. I certainly am committed to that, want to be part of the solution, but want to see us honor our commitment to those that we made that commitment to. And, I was in discussions today with, members of Congress about the PACT Act, which is the Toxic Exposure Act, and making sure that that's funded appropriately, because we have at least $23 billion missing from the budget that's going to go into effect October 1st, that we won't be able to honor that commitment unless we find that funding. So these are very active issues, but they're ones that I think that everybody should be working on together, and everybody aligned on what the outcome is.
These are dangerous times, because distrust has been brought to its very lowest levels on all fronts, and yet a lot still needs to be built. It's very hard to build without some trust. So not quite sure what the answer is quite yet, but it certainly makes
We're
for
working
perilous
on
times.
it. Democracy is not perfect, but I believe in it, and I think that we will get through this, and we just need to make sure everybody keeps cool heads and is thinking about what's the right thing to do.
Yeah, I think a balanced approach. Like, here are the things that we found, here are the things that we're fixing, and here are the things that will always great and remain great. That would be an interesting message.
Right.
Okay, David,
Well,
thank you
thanks
for
so
your
much,
time.
Roy. Enjoyed talking to you.
You got it. Bye.
Thank you for joining us on Analyzing Healthcare. Stay informed and stay inspired. Don't forget to subscribe and visit scale-community.com to become a Scale Community member. Until next time, keep exploring the ideas that shape our healthcare systems.